guys, it's Leah Buckles from Prestige Worldwide Medical Consulting. I am a U.S. Army veteran, former CMP examiner, and physician assistant. Today, I wanted to come on and do a video about obstructive sleep apnea as it relates to fibromyalgia. So I've done several videos in the past about obstructive sleep apnea, and hopefully they were helpful. And I hope today's video is also helpful. So I wanted to start off by discussing what obstructive sleep apnea is, or what sleep apnea is. So there are a couple of different types of sleep apnea. We've done videos on central sleep apnea. Obstructive sleep apnea is the one I see by far more commonly. And obstructive sleep apnea is typically a disorder where your upper airway collapses, or you have some type of obstruction in your upper airway at night that prevents adequate airway passage. So some of the common things that you hear or see are people that snore frequently. Their bed partner may say that they have disrupted breathing, or they're gasping or choking, or they have periods of apnea where they just stop breathing altogether. Typically, when people are having those types of symptoms, they may go for a polysomnogram. Their healthcare provider may send them for a polysomnogram or a sleep study, which is generally an overnight study that assesses and evaluates different things in different stages of your sleep. And then they calculate all of those different events that you're having and determine whether or not you meet the criteria for the disorder. So how are people service connected for obstructive sleep apnea? So you can be service connected on a primary or direct basis. So if you develop sleep apnea while you were on active duty, you were diagnosed on active duty, that's probably something that's going to be service connected. There are also a lot of people that may not have been diagnosed on active duty, but they exhibited signs and symptoms of obstructive sleep apnea, whether that's signs and symptoms that were relayed in their healthcare notes, or perhaps they have witness statements that said, hey, I was with Veteran Snuffy, in the barracks for several years. We were deployed together. I heard him. I saw him having all of these symptoms, that sort of thing, right? So on a secondary basis, I see a lot of veterans service connected for this in a variety of ways. I've done several videos on this in the past, whether it's to upper airway obstructions like allergic rhinitis or chronic sinusitis, deviated nasal septum. Mental health disorders is a big thing that I see these connected to due to hypotonia of the upper airway with disturbances of REM sleep. And most commonly, I see it related to weight gain as an intermediate step, which we've talked about in the past. So if you have a service-connected disorder that has caused you to gain weight, and that in turn was the reason that you developed the condition, that may be a way to show a service connection on a secondary basis. GERD is another one. So, or it could be a combination of several of the above, right? So how does fibromyalgia factor in here? Well, fibromyalgia is a disorder that several veterans are service connected for, either because they were diagnosed on active duty. It's something I see presumptive fibromyalgia, not OSA. Fibromyalgia presumptive to Gulf War service. And if a person develops fibromyalgia, it's very reasonable to assume that a lot of their symptoms cause them daily disruption in their activities of daily living. So they may have, constant fatigue, they may have pain, they may have difficulties related to the fibromyalgia. They may take medications that cause them to gain weight, right? So a lot of things that happen with fibromyalgia are often tied to weight gain, leading back to that intermediate step of sleep apnea. I'm not sure that I know of a specific way that fibromyalgia would collapse the upper airway itself, but through intermediate steps or through other causes related to fibromyalgia, weight gain, medications, etc., that can lead to it, right? So we talked about, okay, what is it, how it's connected. I'm just looking at my little diagram of what I wanted to talk about today. Let's talk about a couple of the studies that I cite. So I've gone over these before, but let's talk about some of these studies about weight gain as an intermediate step. So you can take them to your doctor, and perhaps they can, these can be helpful for you if you're asking your doctor to write a medical opinion for you, which are never required, but they can sometimes be helpful. So obesity, abdominal obesity, physical activity, and caloric intake in U.S. adults, 1998 through 2010, published in the American Journal of Medicine. That's the article I use. Lack of exercise is a major cause of chronic diseases, published in Comprehensive Physiology. Reducing calorie intake may not help you lose body weight, published in Perspective on Psychological Science. So that study in particular, I often see people say, well, weight gain is a choice. People are intaking more calories than they output. Diet can be very helpful in the short term in weight loss, but studies prove time and time again that exercise and inactivity, if you are inactive, and long-term weight loss can be difficult if you're sedentary, if you have a sedentary lifestyle, because it's very difficult to just diet your entire life, right? Again, that's not to say that both cannot be contributory, but if you have difficulty exercising because your fibromyalgia is so painful, because you perhaps are fatigued, or like I said, the pain, etc., or if you're on medications to help treat that can contribute to weight gain, that can be very problematic. So let's talk about the ratings for OSA. So I don't know if I mentioned this in this video or not yet, but I'm not an accredited claims agent. I'm not a VSO or an attorney. I'm not a legal representative. You should have one if you need one. You can get a VSO generally in your county. That's a good place to start. I'm just a medical expert. I don't advise on the claims process at all. I just review files and give medical opinions based on what I've reviewed in some cases, right? So when it comes to ratings for OSA, this is always subject to change. You can be rated anywhere from 0 to 50%. I'm sorry, actually 0% is going to be if you've perhaps been diagnosed. So you can be rated higher than 50%. It can go up to, let me see, 100% right now. Now it could be subject to change. I very rarely see anyone over 50%. Okay. That's why I said 50% in the first place. But 50% is generally reserved for people that have to use a CPAP or some other type of device to help control their symptoms. Okay. 100% can be rated if the person has chronic respiratory failure, if they have carbon dioxide retention, needing a tracheostomy, or needing a tracheostomy, right-sided heart failure, and some other things, okay? 0% is if there are really no symptoms, but you have the diagnosis. 30% is someone that experiences daytime hypersomnolence, perhaps, or just hypersomnolence in general. They're tired, but they don't necessarily need a CPAP. Okay. Again, these are always subject to change, so you should follow up with a legal expert for questions on that. I hope this video was helpful. Please drop some comments on OSA and fibromyalgia if you have any. Also, let me know if there are any other topics that you'd like to hear about. As always, thank you for watching. Please like and subscribe. And thanks for hanging out today. All right. Bye, guys.